Hi, Dr. Jane Hendricks here with Stem Cell for Life in Phoenix, Arizona. I'd like to cover some questions that you, the patient, should ask when looking for a stem cell clinic. There's a lot more choices than there used to be when I first started, which was a very long time ago. And it's been a wonderful modality that I've added to my other integrative medicine and functional medicine modalities for autoimmune conditions and joint health. And so there's the stem cells that come from an FDA registered lab that I've always chosen because I choose quality assurance above all, quality assurance and safety. And so as a patient, you're also looking for that. There's some areas of life where price shopping is good, and some areas of life and even medicine where price shopping is not a good idea. Because of the variation in products, there's just a lot more variety now. Since 2020, a lot of new labs have popped up. Clinics are now processing their own stem cells. That didn't exist when I first started administering stem cell IVs and joint injections. So I wanted to do this video to give you a list of questions, mainly 3, to ask when you're looking for a stem cell clinic. Number 1 is, how many stem cells am I getting? Now, this is especially important in the case of IV, so the systemic infusion for your whole body, because it's not just a small joint space that the stem cells are going to, it's now the whole body. And you want it to get to where it needs to go. So it requires a lot more stem cells in that case. And when I first started doing stem cell infusions, patients were actually going to Panama because there was just one lab that I knew of that was here that was distributing stem cells to physicians. Unlike the international community, the labs here are not allowed to market directly to you. And so the medical tourism, the international medical tourism was prevalent on like Google when you're searching for stem cells. Again, a lot more labs have popped up since 2020, so they're just 4 years old. And then clinics are now getting trained to process their own stem cells. I'm a physician, I treat disease, I'm not a lab. So keep in mind that when a clinic is processing their own stem cells, that's not an FDA registered lab and or registered with American Association of Tissue Bank. And so the first question to ask is, how many stem cells am I getting? For an IV, you need it to be a high number. So if that clinic is unable to give you a number, or they're quoting you in milliliters of fluid, that's not the number of stem cells, that's milliliters of fluid. So you already know that that's going to be a low count. So you should be able to get a quote for number of stem cells if they are administering high dose stem cell IVs. So they might just be doing amnio or a mixed product, and that's why you're getting quoted in not number of stem cells but milliliters of fluid. This is okay for a small joint space, but for systemic IV, you need a higher number, so you'll have to go elsewhere. The second question is viability. And what does viability mean? How alive are they? Now, it's never 100% alive. It's just the nature of processing stem cells. But back in the day, before the FDA passed its regulation 361, I believe, in 2021, it could be 50% viable, meaning they're half dead and half alive for some labs. And so when that regulation came down, that really did clean up the field quite a bit. And so they put it down for 75%. Now, the supplier I use has always been, 5 to 10% higher than that, even before that regulation. So I never had to worry about that. And that was one of the first questions I asked as a physician. And physicians should be asking these questions too. And they should also be seeking out the manufacturer of the stem cells. I think that's important because if a doctor isn't being careful and choosing the right, no matter what it is, the right supplier for anything that they're going to pass on to their patient, then they're not doing due diligence. So I want high quality and I want high safety. And so number of stem cells and viability. And the third question I think is important is, what kind of follow-up am I going to get? Is a nurse practitioner going to just come to my home and give me the IV and that's it? I just go back to my gastroenterologist or rheumatologist and continue on the biologic, which is kind of why I got the stem cell IV, because I want to get off this prednisone and biologic. So I think that's important. I have 2 tiers level of care. The 3-month one where I follow you for 3 months, that means free conversations, emails, visits on the phone. That's if you have any questions. I always guide 100% of my patients. I don't care if it's a knee injection. I'm still guiding you on supplements and anti-inflammatory diet, because that affects your joint pain, how you're eating, your lifestyle, and exercise. I guide you to physical therapy, but especially with the IV, I think it's important and it amplifies the value that you're going to get from the stem cell IV if you have some guidance on supplements and diet, and if the doctor is adept at helping you discontinue some of these more harmful medications that you wanted to get off in the first place. But if you're being sent back to your specialist, chances are you'll never get off of that medication, and so you're paying for that, and it's decreasing your quality of life because many of these medications they cause fatigue, lower immune system. So my goal is to discontinue medications that are harming you, guide you on how to help yourself, whether it be COVID, flu, skin rashes. Sometimes that comes up in conversation. So I've been practicing for 20 years. I've treated about every chronic ailment there is. So you're not just getting a stem cell IV from me. I'm also treating your medical condition with my other modalities that I've been using for a couple decades now. So follow-up care is important in addition to the quality of the actual stem cell treatment and how it's administered and the disclosure of it all. So just keep that in mind when you're calling around, because there's a lot more choices now than there were when I first started treating patients with stem cells. So I thought I would put this video out to help you guide on your phone calls. Also, my website is packed full of information, helping to guide you on the questions to ask. The fact page has that, and also the article on my blog. It lists the different regenerative products that are now available for you. You have a lot of choices now when it comes to joints. Still with the IV, there's only one way to go. There's other things offered, but for your value, there's just still one way to go, and that's a high number of stem cells. Thank you for joining me, and I hope to be offering you a complimentary consultation soon.